we're focusing on professional ethics and scope of practice for your phlebotomy exam. This topic is critical because questions about it are often designed to test your judgment and understanding of your professional boundaries. Your scope of practice as a phlebotomist includes 5 core tasks: correct patient identification, sample collection, proper labeling of specimens, transport logistics, and performing basic point-of-care testing. An exam question might present a scenario where a nurse is busy and a simple glucose test needs to be performed at the bedside. You should recognize that performing this point-of-care test is within your duties. However, the exam will absolutely test you on what falls outside of your scope. This includes interpreting test results, diagnosing a patient's condition, or advising on treatment. For example, a common exam trap is a question where a patient asks you what the doctor is testing for. While you can state the name of the test written on the requisition, you cannot explain why the test was ordered. If they ask, "Are my potassium levels okay?" you must defer that question to the nurse or physician. The most common mistake is trying to be helpful by offering reassurance or information that amounts to a diagnosis or medical advice. Imagine a patient has a large bruise after a draw and asks if they should apply ice or heat. Recommending either is providing medical advice and is outside your scope. The correct action is to report the patient's concern to a licensed nurse. Remember this simple phrase to keep you grounded: collect, label, transport, and defer the rest. This reminds you of your core duties and the critical importance of referring all other inquiries to the appropriate licensed professional. While specific regulations can vary by state, the national certification exams test you on this universally accepted professional standard. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.